So you guys been doing a different presentation every day?
It just depends on the day. Thank you all for joining us this evening. I want to first start by introducing you to our guest speaker tonight, Michelle Vogel. Michelle Vogel serves as Vice President of Patient Advocacy and Provider Relations for CSI Pharmacy. Michelle enjoys helping rare disease patients find a voice in our complex healthcare system. She is honored to be the person to assist patients in navigating their healthcare, finding affordable health insurance, ensuring their lifelong life-saving therapies are affordable and accessible, and making sure they don't fall through the cracks. Michelle began her career 30 years ago as a senior legislative assistant on Capitol Hill for a member of Congress, where she specialized in healthcare policy. Since that time, Michelle has worked as a tireless advocate for academic medical centers, patient organizations, specialty hospitals, and healthcare coalitions. She has years of experience testifying before Congress, federal agencies, and state legislators, and is a prominent speaker on topics such as Medicare reimbursement, the economics of the plasma industry, health insurance reform, Social Security disability, navigating health insurance, and patient advocacy. Michelle received her master's degree in public administration from George Washington University and her bachelor's degree from American University. Without further ado, I will now turn the presentation over to Michelle Vogel.
Thank you, Chevelle. I'm really happy to be with everybody today. And I just want to share a little bit more about myself. My personal mission is to ensure patients have access to the providers they choose, the brands of therapies that work best for them, and the best site of care. I've been working with the myositis community since 2007, and it's been a great pleasure of mine. I specialize in patient advocacy. I love helping patients navigate their health insurance policies. I understand Medicare and Medicaid reimbursement really well, health insurance, and disability policies. My expertise is in patient access issues and specialty therapies, especially immune globulin therapy. And in 2016, I joined CSI Pharmacy as their Vice President of Patient Advocacy. CSI Pharmacy is a nationwide specialty pharmacy dedicated to serving patients with chronic and rare illnesses requiring complex care. About 20% of CSI Pharmacy's patients have a form of myositis. CSI Pharmacy has a patient advocacy department, and as of this year, we've hired 2 more full-time staff members who have expertise in myositis. So there's 3 of us here to help the community. Before I go into explaining about what patient advocacy is all about, I want to share a little bit about why I became a patient advocate. So as Chevelle told you, my first job was working for a member of Congress, but before I handled healthcare policy for him, I did casework. And many of you may have called your member of Congress to help you with problems you have with Medicare or Medicaid or with the VA. And that's what I did. I was a caseworker and helped patients. And I guess that was my first taste of doing a little bit of patient advocacy before I went into health policy. And when I left Capitol Hill, I became a lobbyist and enjoyed that. And lobbying can be a form of advocacy, especially when you start working with the nonprofit communities. And so once I left lobbying and really got a taste of working with the patient communities, I had the pleasure of working for the Immune Deficiency Foundation, which is also a really rare disease group. and I handled their government affairs and reimbursement services. But during that time, and also those patients rely on immune globulin therapy. So that's when I first learned about this therapy and learned about all the different diseases that rely on that therapy. But also during that time, I had my own healthcare struggles. I don't have myositis, but I do have a number of autoimmune diseases. And I do have a rare genetic connective tissue disorder. And so I understand what it's like to go for years trying to find out what's wrong with you and trying to find a doctor who can give you a diagnosis and get that right diagnosis. I also understand when you get that diagnosis that sometimes there isn't a medication that's going to help you. And you may need to rely on other therapies, other modalities like physical therapy and occupational therapy. I understand what it's like to have chronic pain. And I also understand what it's like to have chronic fatigue. And so, I've had my ups and downs. And, luckily, I finally found the right specialists who came together and understood what was going on. And it's still a journey, as all of you understand. When I left the Immune Deficiency Foundation and started doing consulting work, I got to know the myositis community. And that's when I started working with all of you and was able to use my government affairs experience and put advocacy together to work on what we're involved with right now, Myositis Awareness Month. We did a resolution in Congress to declare myositis awareness. And we also worked on getting funding for research through the Department of Defense and other things. And it was about patients telling their story to members of Congress and putting a face on this disease. That things started to change, and it was fantastic. So that is another part of advocacy that's so important. But now I'm going to go into advocacy for individuals who are struggling. So let's talk about the whole field of what is patient advocacy. So patient advocacy is an area of healthcare specialization concerned with a wide range of supportive activities for patients, survivors, and caregivers. The patient advocate may be an individual or an organization, often, though not always, concerned with a specific group of disorders. A patient advocate helps patients work with others related to their health, including working with doctors, nurses, social workers, working with insurance companies, employers, case managers, and lawyers, especially when you're dealing with disability. They help resolve issues about healthcare, your medical bills, disability, job discrimination, education, anything relating to a patient's medical condition. We raise public awareness about the disease, about healthcare issues affecting communities, like needing affordable life-saving enhancing therapies, education about rare genetic and chronic diseases like myositis, diagnosis and treatment for these diseases by specialists, by the rheumatologists and neurologists and dermatologists that we all rely on. Work to bring about change that will help ensure the quality of care for patients, caregivers, and their families. So all important things. As a patient advocacy, you can direct a patient toward the appropriate doctors and healthcare resources, assist a patient in following treatment plans, help the patient take advantage of all available treatment options. A lot of times we think that we can't afford certain things, and there may be programs out there that are available to help you make those more affordable. Helping navigate insurance could be a full-time job to find the solutions to these expensive medical treatments. Coordinating care between healthcare providers is really difficult. Providing access to helpful resources, such as education, financial assistance, support groups, such an important place to get help, government benefits, and so much more. So the importance of patient advocacy: patient advocates take actions to uphold the rights of those in their care. They defend patients when their right to quality care is marginalized. They speak up on behalf of patients who are too timid and often too sick to ask the questions or voice their concerns. And they support patients in choosing the best treatments. What makes a good advocate? Well, you need to have excellent communication skills. You need to be empathetic, but you can't be so empathetic that you lose focus. You need good organizational skills and time management skills, the ability to research to solve problems. And you need to be creative because some of these problems are really difficult to solve. The ability to get along with many different types of people, including the patients, their families, their caregivers, and professionals. The ability to be politely assertive and able to both provide respect and command, respect from the many others involved in patients' care. And really an attitude that every problem has a solution. And that's something I learned in my first job working for the congressman. If I ever went to him and said I couldn't solve a problem for a constituent, I was in trouble. So I learned early on that you can solve these problems. You need to be creative. You need to look hard, but there is a solution to every problem. And the word no is not in your vocabulary. And that is something that I live by every day. So when we talk about the different types of patient advocates, not all patient advocates are equal. And there's different terminologies based on what side of care or where you're going to get help. So let's start with the hospital or healthcare system. The advocates in these places, some of them have patient advocates with those titles. Some have social workers or caseworkers. Most of them have a background in social work or other forms of customer service. They do troubleshoot and try to help solve problems for patients, but you need to know that many of their decisions must be made in favor of the facility and not necessarily in the best interest of the patient. So knowing that going into that, you'll be okay if you understand what your expectations need to be. Health insurance companies. So I often advocate, especially for rare diseases, to see if you can get a case manager or caseworker at your health insurance company. I know it's hard calling that 800 number and explaining your story every single time to a different person. If you have a child, most insurance companies have case managers for pediatrics. And so you can request that. I used to say, send a picture, especially if you have a child, to that case manager so they can see who they're talking to. And that way that you're talking to just one person all the time to help you navigate their system. But also understand that their job is also to save the insurance plan money. So they may be helpful to help figure out where to go to, but you need to understand where their motives may be. Industry. So what is industry? That's your, I work for industry. I work for a specialty pharmacy, home infusion company. Also, the pharmaceutical companies are industry, and some of those companies actually have salespeople who are called patient advocates. That bothers me personally, and so you need to understand that. So if somebody says that you can only get help if you are a patient of that organization or you use their product, then you know that. I know that joining a CSI pharmacy, that was not required of me. And even better, we made a policy that we would help any patient needing help, and they do not have to be a patient of CSI. We have that on our website. We have it on our materials. We're here to support the community, and we're here to support the myositis community. So anytime you need help, you can reach out to us. So I look at real patient advocates that will help you navigate your insurance and reimbursement, assisting copay assistance, and be supportive of your needs, whether you buy their products or services or not. So then in the government, I explained to you what members of Congress and also on the state side, your assemblymen and your state senators also have caseworkers, but there are also case managers who will work with Medicare patients through the Centers for Medicaid and Medicare Services, Medicaid, and it works for VA. So you have any of the federal and state run systems, there may be people who are going to help you through that. Nonprofits, those who work in patient support organizations are often patient advocates at heart. And I would say most of them are patient advocates at heart. But you have to also understand that their jobs involve other priorities, including fundraising and patient education, patient programs. And so they may not have individuals who can do the kind of work that's like a full-time job, helping with the casework. So that's where they can rely on others to help them. And I'm here to help Myositis Association with whatever needs they have. And then you have other healthcare professionals who consider their role to include patient advocacy, and that's nurses, social workers, doctors, and other healthcare professionals. And I want to say something about our doctors. I discussed how time-consuming and how difficult it can be solving some of the problems we have. And doctors have a full-time job with working to see all their patients and handle their care. So often I'll get calls and say, you know, my doctor won't help me with this. I think they need help to do it. And so I find partnering with your doctor's office that you get so much done. And they're there to help you in every way, including their nurses and their staff. They just need that assistance. And so we can all work together to solve the problems. So this is my favorite, volunteer advocates. Many patient advocates are volunteers. They assist loved ones, family members, or friends in roles such as bedside advocates in the hospital or caregivers. They can help you navigate your insurance or find solutions to make your healthcare needs more affordable. Sometimes their most valuable role is to hold your hand, lend a sympathetic ear, or transport you to the appointment. And this is so true. Their compensation comes in the form of the satisfaction that comes from helping someone else. Now, I did not cover paid patient advocates in the private sector because I don't really understand that role yet. I know that it's a growing field and that they're even have now certification for patient advocates that's growing. And so it's something to look at if you look to hire a patient advocate, if they're certified in the private sector. But I don't know that much about it. I've just always donated my time to be a patient advocate. So let's talk about being an advocate in the myositis community. So we need to work together as a community in order to improve access to quality and affordable health care, obtain disability benefits when needed, to get the care we need from a specialist, and have access to medications to treat our diseases. We are all patients, family members, caregivers, and healthcare providers who understand the challenges of our community. So when I talk about challenges, When we go through a healthcare crisis, it may be difficult to find a physician, often a specialist who's knowledgeable and able to diagnose the symptoms we or our family members suffer with. I know I've been through that. And once a diagnosis is made, the challenge becomes finding and accessing medications that will adequately treat our diseases. And sometimes there aren't those medications. And then finding a way to pay for ongoing treatment and care may be a challenge. One of the worst things I hear from patients is that I have to try to decide, can I pay for food to put on my table, or pay for my medicine, or pay for an expensive diagnostic test, or rent, or my mortgage? And that should never be a choice. So, being able to find ways to have affordable and adequate health insurance, get the disability benefits you need, and when you need Medicare or Medicaid, find a way to be eligible for it. These are all things that we face. And then it gets into health insurance questions. So we worry about, what if my plan won't reimburse me for the prescription my physician has written? And what if I can't afford my plan's out-of-pocket costs? These high deductible plans, co-insurance, it's a struggle for any of us. For the Medicare patients, the donut hole. So how do we make this all work? And what if my health plan denies coverage for the drugs, for the specialists I need, or the diagnostic testing to determine any changes in my diagnosis or care? And as we keep on getting a more sophisticated testing done and more therapies coming into the market, we want access to these things, and we want it to be affordable. And we want our insurance to cover it without these huge out-of-pocket costs. So every day, patients with rare and chronic diseases experience these problems and work closely with patient advocates to find solutions to these problems. And the solutions aren't simple, and they are definitely time-consuming. So I've said this before, and I want to go over it once more. You are a patient advocate when you accompany a friend or family member to a doctor's appointment to be a second pair of eyes or ears. Speak up for a friend or family member who has trouble communicating their needs. I know that when we go to the doctor's office and the doctor says, how are you feeling? And oftentimes we'll say, I'm fine. You need to complain because it needs to be documented. If you're going to get, coverage for any of these medications, for a wheelchair, for a walker, for anything, if you're going for disability, everything needs to be documented. Keep a journal. You need to be able to communicate all these things so it's in your records. Patient advocates help interpret or complete physician instructions, government documents, and health insurance forms, which there are a lot of. But be the person your friend or family member turns to when they need help with their care, or just someone to listen to their families. And there's so much more. So the one thing I want to say to all of you is that when we are sick and we need the help, we wanting to get it, and we definitely don't want to fall through those cracks. When we're doing better and we've figured out how to navigate that health insurance problem, or found that specialist, or learned how to work with the different doctors, just find helpful hints. When we're doing better, how much better it would be if you can be an advocate for others. I mean, it doesn't matter how old you are, where you live, or what your diagnosis is. It matters that you want to work with others to make a difference. And the more people in our community that want to become advocates, the more help we can provide to all patients who have myositis and their caregivers. And what a community we can be. We can all be successful if we all become advocates. So I hope that you're ready to do that, and we can start working together to really truly make a difference. I say this and I mean this with all of my heart, that you need me, contact me. I promise I will respond to you. You can call me, you can text me at that phone number. It's my cell phone number. I will respond to you. There's my email address. I will get back to you. If I don't have an answer, I will find someone who can help. I don't want anyone to feel alone. There are people out there that can help you. And I've got others with me who are ready to jump in. And with that, type in your questions into chat, and I'm ready to get started answering your questions.
Thank you so much, Michelle, for sharing your experience and expertise with us on patient advocacy. If you do have any questions for Michelle, please enter them into the chat box below. We did get a comment, Michelle, that states that you are awesome.
Well, thank you.
Okay, it looks like a question came through in reference to housing.
Okay, so yeah, so there are, it depends on what you mean by housing. So there are, for people who need affordable housing, we can help with trying to find that through government programs. If it's in regards to needing equipment for your house, that's also a big need within this community. And we could look to see, there are some organizations that provide assistance. Some things are covered by insurance, and there's some charitable organizations. So we can look into ways to try to find help meet your needs.
Okay, we have another comment that came through that says that, Michelle, that the Jacksonville Myositis support group is so grateful for your expertise here in the Jacksonville area.
Well, we do have a support group here in Jacksonville. Unfortunately, like everybody else, that with COVID, we had to, put it on hold. It's held at the Mayo Clinic here in Jacksonville, and we're hoping to get it back live as soon as it's safe to do so, which is sounding like we're getting closer to that point. Unfortunately, our members didn't really want to do Zoom, so we're really excited to get it going once again. And in Jacksonville at the Mayo Clinic, they do have a myositis clinic there. So we work with the doctors and the physical therapists, and we've got lots of exciting programs hoping to get started again.
Okay, and it looks like we do have a few more questions that came through, Michelle. The first one is there anyone who would be able to help with searching for a scooter or wheelchair?
So we can definitely email me or call me, and I will try to help you with seeing where we can get you assistance, sometimes through the Muscular Dystrophy Association. They have equipment, and there's a few other organizations we can check into. We can also see if your insurance covers it.
Okay, the next question. Do you have specific suggestions when the insurance company will not approve the higher dose of Ivig ordered by the doctor in the case of autoimmune disease, but will only approve a lower dose?
So I'm excited to tell you, well, it depends on what myositis you have. So if you have dermatomyositis, there was just a clinical trial finished by Octapharma called Proderm that is all about 2 grams per kilogram they're dosing. And they're going for an FDA indication, which should be approved shortly. And so that will change the dynamics of insurance coverage for IVIG for dermatomyositis. A lot of the insurance companies tie polymyositis and dermatomyositis together, so that should help the guidelines. Most of the guidelines that I have read all cover 2 grams per kilogram. So if you want to message me, I will look at your insurance and see what I can do to help you get your dose up to where it needs to be.
Thank you, Michelle. The next question is, what if I'm too fed because of aspiration pneumonia? My internal fee is through Option Care in my United Health plan, but they use Walgreens as DME, and that is not in my plan for my Joey feeding pump and supplies.
Wait, repeat the question one more time for me.
Yeah, no problem. What if I'm too fed because of aspiration pneumonia? My internal feed is through Option Care in my United Healthcare plan, but they use Walgreens as DME, and that is not in plan for my Joey feeding pump and supplies.
So they should cover all of your supplies through the whatever's in network. And if the company in network can't provide it, most of the insurance companies will allow another company to come in and have a special contract with that company. So again, if you want to message me, I'm more than happy to look into a case with you and see what I can do to help you.
The next question, do you offer referrals for licensed contractors who can evaluate your home and give estimates for remodeling?
That I don't do. I can look and see if there is anybody, if there's any organizations in your area that do that. But that I have not ever been asked to do.
The next question, can you explain the changeover from insurance to Medicare at age 65? IVIG and oxygen is used.
So when you turn 65, so this is important, and I want to go over Medicare since you bring up Medicare. For patients who are on Medicare and they turn 65, you have a choice of either doing traditional Medicare or Medicare Advantage plan. If you pick a traditional Medicare plan, you get your Part A, which is your hospital, your Part B, which is the outpatient side of hospital and your physician, and you have Part D, which is your drug coverage. You also need to get a supplemental plan. And so that is all offered to you. If you don't get the supplemental plan at 65, then you are subjected to for the company to look at your past medical history and can increase your rates on you. So, and they can deny you coverage for pre-existing conditions. So you need to pick that right away. A Medicare Advantage plan, which many patients go into, you have a choice of a PPO or HMO. You always want to check and make sure your providers are participating in it. Many times it's less expensive, but you may need to go through referrals with it. And you also want to see that it has coverage where you can go out of state in case you need to go to a specialist that your area doesn't have. If you need specifics on where your coverage is, your IVIG is covered under Part B if you go to an infusion clinic. It's covered under Part D if you need it in the home. And oxygen, I need to look and see exactly how that's covered. And if you want to, again, message me, I'm more than happy to look at your specific needs. And if you need help with looking at different plans, I'm more than happy to look at that with you.
Thank you, Michelle. The next question is, how would I get connected with the Jacksonville support group? I'm just a few days into a DM diagnosis and live in a small rural area in Georgia.
Message me and I will put you in touch with the group.
Okay. The next question is, the clinic someone referred to in Jacksonville at Mayo?
Yes, it is. So there is a neurologist at Mayo Clinic and a rheumatologist at Mayo Clinic that both see myositis patients. And then they also then send you to, they work with pulmonology, and they'll send you to whatever specialist you need. And they also work with the physical therapy and occupational therapists.
Okay, the next question. I have PM and my rheumatologist tells me that I would feel much better with Ivig, but he charges $2,000 per infusion. I tried to get infusions from a neurologist, but he needed my doctor's referral, but my doctor does not respond to his request for a referral. What should I do? There are no other doctors in my area that handle this.
So the charging you of $2,000 first, is that because you have, is that including your copay? Is that because you have a deductible? There are brands that have copay assistance, including for myositis patients. And you can also ask the doctor if he's willing to do home infusion, where some of the companies provide assistance to help you with any out-of-pocket expenses. And so, I mean, if they have their own infusion center, it may be that they want to keep you there. But I would check to see if home infusion is an option. Nurses come to you even in the rural areas, and there's a lot of competition. So people are looking for patients.
Thank you, Michelle. The next question is, are there any pieces of federal legislation or initiatives that are being proposed that we should be tracking for our myositis journey that will be beneficial to our rare disease?
So there are pieces of legislation. Right now, I don't see major movement on healthcare legislation, even though I would keep an eye on it. There's a big prescription drug reform plan. I think that they'll be continuing to do some work on the exchanges to try to make it more affordable for patients to get the plans, to provide, they're looking to expand Medicare through that so that there's the public option, because a lot of the choices are very limited in areas and are very expensive. And so there are things that I would say the administration wants to do. It's a matter of getting Congress to move on things, and it's a real struggle right now. But we can look at that and see what opportunities, and working also, the National Organization for Rare Diseases is always involved in many of the issues. And so we can look and see what would be great issues for the community to be involved in.
Thank you. And we do have another question. I was just diagnosed with IBM and am in the middle stages between walker and wheelchair. At some time, I will have to apply for disability. At 59, I'm too early for Social Security. How long is the process, and are there support groups in the New Jersey area?
So you need to start your disability process, because the day you apply for disability is the day 2 years from that date is when you become eligible for Medicare. So you can get Medicare benefits under Social Security disability, but there's that waiting period. And so the sooner you do it, they then go, it can take a period of time, so they can go backtrack, and if it takes longer than 2 years, they'll go to that 2-year point and then give you more benefits. And so you need to get that going. In terms of other things, I mean, you know, you can also, depending upon your situation, you may be eligible for some other programs. But I definitely would not wait at this point. And in terms of New Jersey support groups, Chevelle, can you answer that one?
I do believe that we do have some support groups. I can definitely look into that and get back to you. Okay, Michelle, we do have a few more questions that did come through. What if you get prescription for Seabreed, Neohaler, and Walgreens doesn't have it? And what price would it be on United Health retired employee plan? I have sporadic IBM and Optum RX doesn't want to cover medication for excess saliva due to tube feeding.
So the pharmacy cannot get it for you. Is there, I wonder if there's another pharmacy within your health insurance that can, and even potentially a mail order pharmacy. So please message me and let me see what I can do to try to help you find out who has access to that drug and where we can get it for you.
Okay, next question. If I'm having the IVIG treatment, can I get the COVID-19 shot?
Yes, you can. So there you can do that, and you may want to just reach out to your doctor to see if there's any time period to coordinate your vaccine. But there are a lot of patients who are on IVIG getting the vaccine, and they're fine.
Thank you. Next question. Do home infusions require a permanent port to be installed? Also, my doctor won't approve me for home infusions.
So the answer is no, you don't need to get a port. We can do it through IV, and then there's also subcutaneous form of immune globulin. So if your veins are failing you and you don't want to get a port, you can go to the subcutaneous route where you do it in the fatty tissue, and you do it weekly, and you're taught how to do it. And people are doing fantastic on that. I've encountered some doctors who do not want to do home infusion. Most of the time, that's because they have their own infusion clinic, and so financially, it's in their best interest to keep you in the infusion center. If you've gotten IVIG in an infusion center and you haven't had bad reactions to it, then there's no reason why you can't get it in the home. So it's something that I've had discussions with doctors, and a few doctors who I've spoken to who said absolutely no way are they going to have their patient do IVIG in the home. Some of them were fine with then switching to subcutaneous IG, and we're able to do that as an alternative. And in other cases, we're able to work it out, or we found a doctor who was willing to prescribe it. You should be able to choose which site of care you want to get it in. And again, I never push one site of care over another. Patients love infusion centers. I've been infused in infusion centers. And so it's your choice, be it in a hospital, in a private infusion center, or in the home. But it's all about choices. And so you should be able to make that decision and find a doctor who's willing to work with you.
Okay, thank you, Michelle. And it looks like we've gotten to the end of our questions. So I wanted to thank you again for your time, and also thank all of you for joining us today. Make sure to visit CSI Pharmacy booth at our virtual summit on Saturday, May 22nd. Enjoy the rest of your evening and have a wonderful night. Goodbye.
Bye.